All right, listen to this. Many people are calling this a miracle. A Florida mom survived for 45 minutes without a detectable pulse after giving birth. Ruby Casimiro had a C-section, but suffered complications that stopped her heart. Doctors called in her family and were preparing to pronounce her dead when her heart began beating. Some medical experts believe Ruby had a condition in which amniotic fluid leaks into the bloodstream, causing blood clots and cardiac arrest. Mother and daughter, thankfully, are both doing well and are at home. And in other medical news, a report says accidental poisoning from laundry detergent pods sent more than 700 American children to the hospital. Dr. Jamie Wells is a pediatrician and clinical instructor at the New York University School of Medicine, and she's here in our New York studio. Welcome back.
Thank you so much.
Good to see you. Before we talk about these pods, which has been all over the news recently, let me go back to this woman who had the C-section and her heart stopped and they couldn't find a pulse for 45 minutes. Have you ever heard of anything like that?
I've heard of this, and there are a bunch of situations which are thankfully so rare that can happen like this. And honestly, the greatest gift here is that she had the baby first. It could have been a very different story had the baby not already been born. But it depends on what they did at the time of resuscitation. They obviously acted quickly, gave her a ton of oxygen, which preserved the brain. So the thing that is most miraculous to me is more so the preservation of her normal neurologic function.
Yes, yes. Because we really only have a few minutes before the brain begins to suffer injury from lack of oxygen.
Right. And
so that 45 minutes is incredible.
This particular condition, they have almost like an anaphylactic reaction to that amniotic fluid, but that's typically confirmed post-mortem in terms of it being an amniotic fluid embolus.
Yeah,
so
yeah. Well, thankfully they didn't have to do that.
I know.
All right, let me move on. I said I wasn't going to talk about that, but it is kind of fascinating, I have to admit. Let's talk about these laundry detergent pods.
Yes.
This has been popping up in the news a lot, particularly these last few months. It's mainly because kids think that this is candy because they're so brightly colored. What happens? What's the toxicity here?
Well, the toxicity they're uncertain of. It could be some of the solvents in the plastics. The material is more concentrated in the laundry pods than with the detergents in the dishwasher pods, so they've had less issues in terms of that. So part of it is some of them are aspirating it into the lungs. If they break part of the seal, if they get it into their eye, they've had coma, they've had a death in terms of that. But the number one problem with children less than 5 is accidents and ingestion. So every single week, if you've ever practiced pediatrics, you'll get a call, my child ate their own poop, my child ate the dog poop, my child ate the cat litter.
That's just lovely, Jamie. Thank you.
So anything that has desirability, a child will ingest because they stick everything in their mouth, in their nose, in their ear, in their anything. So if you have to have a chemical of any sort, you want to put that high and away. So you have to take responsibility in terms of that. But it seems like the majority of these issues happen at the time of use. So that's where you have to either take it out of the home and not have it in the home for those people who have small children, or make sure that you are hypervigilant at the times that you're going to be using any kind of a chemical.
And remind us that if your child does put something potentially poisonous in their mouth, what should you do? Well,
immediately, if someone's unconscious, not breathing, you call 911. You never delay care to find out what it was. You can always send someone back to the home. If it's whatever it is, if you witness it, you can always call your local poison control center, and that should be an emergency number readily accessible with all your main numbers. And there they will tell you what to watch for or not. And always try your best to keep whatever it was that the label or whatever the product was that someone ingested.
Yeah, so important. It's so important to have that number ready and easily accessible. Okay, let's move on before we run out of time. New study shows that there's an increased rate in colon cancer in a surprising group, young folk. Tell us about this.
There's decline. The good news is there's decline in above 50. That's because people are screened with colonoscopies over 50. The prevalence is so much higher in 50 and above, especially 75-year-olds and above. So they've kind of been neglected a little bit, the 20 to 40-somethings in terms of colon cancer. I would say that the more knowledge that we have right now is that the numbers are escalating exponentially, and by 2030 they're going up by 90% and 124% in terms of colorectal cancers. So bottom line is healthier diets diets higher in fiber, less red meat and processed foods. If people are getting screened earlier, You should know your family history. That's very important. Certain disorders in the 20s and 30s occur and makes you at higher risk. And a lot of times in that age group, people are less inclined to go to the doctor regularly and follow up on their care. So be your own advocate. Know your own family history. Know your personal history. Healthy diet, lack of a sedentary lifestyle, be more active will help you in terms of reducing your colon cancer risk. Also, not smoking, not drinking, and having less belly fat apparently reduces those risks. But
yeah, those
young
things
adults
tend to be a panacea for almost everything. I want to ask you two things about
Yes.
this before we move on to the last topic, and that is, first of all, do we know why they're seeing an increase in the incidence?
They don't know exactly why. They hypothesize in developed countries we're seeing higher rates of colon cancer than other countries, so a lot may be attributed ultimately to diet. A higher fiber diet is going to be a reduced risk factor for colon cancer, in addition to being more active. So we're a little too sedentary, and I would imagine as well that what we're going to find out is screening processes are much less
Well, and
obsessive
speaking of
and
that,
younger.
that was my second question, and then we do have to move on, and that is, are we seeing this enough? Is this a big enough population? Perhaps the recommendation for screening the age to go down to
Right.
catch these?
Well, bottom line is young adults tend not to go see their primary care physician for routine issues in terms of that, but who needs a colonoscopy? Not that has risk factors in itself. So it's very important that we get young adults to focus on their health care, which is a challenge.
It is a challenge, but it is very important to do. Okay, let's get to this last study, and it's about the effects of, I think, extended use of marijuana on the brain.
Right.
Seems very common sense to me. Marijuana kills the brain. All right, tell us.
Any substance that you're needing on a daily basis to function means more often than not that you're self-medicating for an underlying mental illness, psychiatric disorder, or some other kind of issue. So if you're requiring any substance, albeit a approved drug or an illicit substance like marijuana, which is becoming more legal in certain areas. This study in particular was on those who used heavy amounts of marijuana, chronic long-term abusers of marijuana.
And what did they see in terms of the effect on the brain?
So what they saw is, bottom line, more research needs to be done. But the fundamental thing they saw is their orbitofrontal cortex is diminished compared to abstainers, people who don't use marijuana. Some of that subset were pure marijuana abusers, and others were with other drugs that they don't really go into in terms of that. This portion of the brain, which is orbit above your eyes, back here basically, is in control of your judgment to a certain extent, your addiction, your pleasure center, those kinds of things. So the question is, does marijuana cause shrinking of that area? Or do people who have smaller areas there have a predisposition to abuse pot? But they found greater connectivity as well.
Okay, all right. We'll have to leave it right there for now, but again, that seems common sense. Dr. Jamie Wells, thank you.
Thank
Appreciate
you.
it. Good to see you. And